Hello, and welcome to another episode of 3 and 5, an educational series for hospital executives brought to you by CompleteRx. I'm your host, Senior Marketing Specialist Rachel Rahm. In today's episode, we sit down with CompleteRx Vice President of Support Services and Disaster Planning Industry Expert, Ken Maxick. Ken offers a few eye-opening lessons we've learned after assessing our own disaster plans over the last 8 to 12 months, and a few tips on how you can improve your own disaster plans. So welcome, Ken. Thanks for joining us in today's episode.
Well, thanks, Rachel. It's good to be able to sit down with you and discuss this timely subject.
Definitely. So, Ken, today we're discussing disaster plans and how to improve them. Typically, when we think about a major disaster and planning for preparedness, we think about things like hurricanes or other natural disasters or even fires, specifically disasters that we would consider short term. Is it common for organizations to consider and plan for a long-term disaster like the ongoing COVID-19 pandemic?
Organizations will change the way they look at disaster planning. And yes, disaster plans and disaster drills have revolved around what is most likely to occur in your area and your related geographic or geography. In the Centers for Medicare and Medicaid Services State Operations Manual, the focus is on three key areas: safeguarding human resources, maintaining business continuity, and protecting physical resources. Part of the issues we have had in this case is in looking at the all-hands approach, the U.S. has not been exposed to an infectious disease of this magnitude in quite some time. So maybe your organization did not include a pandemic response. The other question that will need to be raised is there has been so much emphasis in developing a just-in-time supply chain that when this pandemic hit, we immediately faced shortages of vital equipment and supply. We discussed the lack of ventilators, personal protective equipment, and pharmaceuticals. This should be a call to have minimum stock levels of what is vital for our supply.
So, with COVID-19, we know that the largest obstacle everyone has had to work around and work hard to prevent is the spread of the virus itself. This certainly affects staffing in a few different ways. Even across our own organization, we've had to be very creative with our staffing models and supplemental staffing solutions. Has pharmacy staffing been an area of focus in past disaster planning? And if not, should it be for the future?
The protection of human capital should be part of everybody's disaster plan. In this case, because of the infectious nature, we saw a lot of innovation being done around staffing. Organizations changing their shift to allow for fewer people at one time to be in a central area, or some organizations went into teams so they would break up the department into Team A and Team B. So this way, in case one team was exposed, the second team was still available to provide continuity care. Mm-hmm. We also saw a much greater use of remote order entry and verification. Staff were not only permitted, but requested to work from home, and organizations set up home offices with direct access computing and voice over internet phone service. This was evaluated against the risk of exposure to protected health information and compliance. However, now several or many of the workers have gone back to their departments. The question that we need to pose: were employees working from home more productive than them coming into the department? We may find that our innovation during this crisis actually has provided us a roadmap to being a more efficient organization.
Yes, I certainly think that has been a common denominator during this time. The pandemic was almost a catalyst for us to transition to a smarter and more efficient way of doing things that we have historically done the same for years. So, having mentioned remote order entry, have we found that other telepharmacy solutions are a good compromise to incorporate into pharmacy operations during a disaster?
Yes, one of the areas that pharmacists are frequently called upon is for drug information. This is an area that telepharmacy can be used for both when the patient is in the facility and for any follow-up about medications. So instead of having a pharmacist enter the patient's room, they can speak to the patient either through with the television or through a separate device. Mm-hmm. A good area to look at is if you have the ability to have a pharmacist contact the patient 72 hours post-discharge to inquire about any medication-related issues. This will allow the pharmacist to address any areas of medication compliance or access and potentially reduce readmissions.
Sure. So, Ken, I want to close out our conversation with a question about the vaccine rollout because this is a big part of what is going to help us win the fight against COVID-19. My guess is this is not something naturally built into disaster plans. So, what measures can organizations incorporate into their future disaster plans to ensure we are better prepared in the event that this ever happens again?
With the vaccine rollout, we have once again been able to show what an important role a pharmacist plays as a member of the healthcare team. Many organizations have called upon pharmacists and pharmacy technicians to assist in the vaccination of healthcare staff. We receive photos from staff both giving and receiving their vaccines during this historic time. Now, retail pharmacists will have an opportunity to contribute to the well-being of their patient population served by beginning to vaccinate the general public.
Hmm.
Organizations will and should go back and reevaluate their disaster plans and codify the decisions that have been made and determine if these decision trees can be applied to other disaster preparations. Remember that part of the learning process is not just applying this to the same situation, but to review how this could impact other types of disasters we may have or face in the future.
Right. So just learning, and reviewing and reevaluating. Well, Ken, thanks so much for your time and for sitting down with us today. You've highlighted some key takeaways for our listeners to consider as they continue to evaluate and revise their disaster plans, not just for the ongoing crisis we're facing now, but for future disasters so that they can be better prepared. So thanks again for your time. I appreciate it.
Thank you, Rachel.
Thank you for tuning in to this month's episode of 3 and 5. If you enjoyed the content, please give us a like or share, and don't forget to subscribe to our social channels to keep up with this series and much more content from CompleteRx.